Ketamine is an anaesthetic that is used in general anaesthesia in selected circumstances. But it's quite a unique drug because when used at a dose below the level that actually causes anaesthesia, it can produce a profound analgesic response. And so it's often used for management in emergency departments, such as managing burn pain or fracture pain or other particular acute pain issues. Now, it has some interesting factors associated with it. And one factor is that it's able to treat nerve pain quite remarkably well when used as an intravenous injection or as a continuous infusion of a low level of the agent. And so in selected circumstances, we'll have people who have a crescendo of increasing nerve pain, what we term neuropathic pain, and they can be elected to actually have an inpatient treatment over several days where the medication is infused in a vein in the arm to receive the ketamine and build up the dose over time. Now, we are still working out exactly who benefits from this and how long they benefit for and so forth. So the results are of modest improvement in a number of patients. And we can see improvements that can last for weeks. Sometimes we see improvements that last for months in this regard. But if somebody tells you that ketamine is a cure for chronic pain, then I have to tell you, frankly, it isn't. It is something that can be used in particular circumstances where there's an acute exacerbation of a neuropathic pain. Another area that is interesting is the use of ketamine in psychiatric conditions, particularly in the use of depression and particularly in the use of ketamine for suicidal thoughts. Now, this is an area that I'm not an expert in. I'm not going to talk in detail about it, but it's an evolving area where there are ongoing clinical trials, and in selected cases there are psychiatrists who are prescribing this for their patients. I think the most important thing to realise that whether this is being used for a underlying mental health disorder or whether it's used for chronic pain, we always need to be aware that it's only a proportion of patients who respond. So we have this concept called the number needed to treat. That is, how many patients need to be treated with a medication, for example, for one to benefit who might not have benefited simply from the placebo effect of it as such. And for ketamine, we're still trying to work out what that number is, that number needed to treat, but it's probably somewhere around the 6 mark, which is exactly the kind of figure that we see for a number of our other analgesic drugs that we have available to us. So it's probably nothing special in that regard, but suitable for a subset of patients. If this is something that you would like to know more about, please go talk to your pain specialist about whether it is appropriate, and they can give you more information and tell you if there are other more alternatives that may be better suited to your condition.